So this is an urban forum on urban health, and the idea of the whole urban forum, or the urban health forum, it is organized with UN Habitat and WHO, and it's an evolving model by which we start from a source book on integrating health in urban and territorial planning, and we link different models to it. Unfortunately, my co-chair, Pamela Carbajal from UN Habitat, she got stuck in the airport and had to return to her place, so she won't be there, so have patience with me. This is also supported by Metropolis and UCLG. Metropolis at the moment, they have their own World Metropolitan Congress, so they cannot be present. As we speak today, the COP26 is in full swing, and we hope for bold decisions. And especially as ISOCARP, we hope that also cities and planning will be higher on the agenda related to climate. Because cities face increasing threats from climate change, related impacts, and they put the well-being and the health of our citizens at risk. They can either directly impact the health, but also indirectly. For instance, through increased air pollution and rising temperatures, which can endanger the health-related urban systems. And climate is not the only crisis. There's the climate and biodiversity crisis, being the greatest health threats. And the world, in many places, is still coping with the COVID-19 pandemic. Mental health conditions, they are increasing worldwide. And the non-communicable diseases, they're also considered the epidemic of the 21st century. The way this plays out is different in each local context and city, and it can affect diverse citizens and communities also differently. At the same time, these multiple crises together, they are an enormous opportunity to improve the environmental, physical, and mental health and well-being, while also taking into account the gender, the diversity, and the local context, age and gender. So in this session, we will have a panel debate and provide the space for interactive discussion. What planning opportunities and strategies to improve health and well-being of our urban residents and families in this context? How to use planning tools to mitigate or adapt? What lessons and what concepts are being explored in the context of arid and hot environments? The panel will include experts from the private and government sector, ISOCARP's Community of Practice on Urban Health, and ISOCARP Institute. We would normally also go underground with Antonia Cornaro, and here an out-of-the-box perspective, but also unfortunately she got stuck in the airport, so she cannot join us. We will have an opportunity later to discuss this. And then we will, at the end, have an opportunity to look to some of the tools that some of the partners developed. But first, just a few words on the Community of Practice and the Institute. You all know ISOCARP. It was established in 1965 with projects, young planners, professional projects, advisory teams, also mentor student research labs across the world. Yearly World Planning Congress. Yes, urban planning advisory teams. A number of publications, also this World Planning Congress, we issued a new publication. And we have collaboration and partners, also institutional members. The ISOCARP Institute is an important part of ISOCARP. Federico, you can say a word or two about. Yeah.
Hello, good morning, everybody. If you have questions about ISOCARP, of course, we have. I'm working at ISOCARP Secretariat, together with my colleagues. So you can always ask us questions, and you can always reach out to us. I'm working for ISOCARP Institute, which is the project office of the ISOCARP Society. It was founded in 2016. It's operative since 2018. and it mainly focuses on 3 different pillars: research, practice, and academy. So the ISOCARP Institute is involved on some European funded projects. We're also running activities of technical assistance, so the evolution of UPATs, and we're also active on the part of academy, so developing training, capacity building programs, and the young planning professional workshops. You will see, when we might have the chance to discuss later, also the Institute is involved in one of the projects related to health and well-being, a nature-based solution which is called Var Cities. Thank you.
Yeah, thank you, Federico. And last year we established a community of practice on urban health also. So the idea is to share, build, and advocate for knowledge and capacity. It's a group of 30 members at the moment, and we are open to grow. So we are growing organically as a community of practice. We have both practitioners and research people there, members. What we did so far is, for instance, contributing to articles as a community, so with different voices from different regions. For instance, during COVID, we also share knowledge, so we're building up some kind of knowledge base to capture the moment in certain situations, for instance, during COVID also. The paper has then been selected and is now part of the COVID papers from the Routledge publication on citizen health. And then some of the members are invited in panels on that topic. We are since this year also part of a new global alliance on cities for children. That's together with representatives from the Institute and the community of practice, because there is a large overlap between children and health, and we have quite a few people with expertise in the health, urban health, from children, youth, and early childhood. We organize together with partners. It's in fact a community of practice and member-based activity. That's important, and we use also models like Urban Thinkers Campus to have different thinkers together and work around the topic with partners, for instance, the one on nature-based solutions and green public spaces for health and resilience. Yes, and we also recently established a partnership with Metropolis. They also have a strong interest in urban health, and we were invited for a Metro talk very recently, published last month, I think, and a blog on climate and health. So we do this together with UN Habitat and WHO, that together established the source book on integrating health in urban and territorial planning. That is downloadable for free on the webpage. And we will look, and it's actually a world first, to a video of what the source book is. Can you please, it's the YouTube link. Yeah.
Today, cities around the world are facing the major health challenges of our time, from tackling the spread of infectious diseases to ensuring healthy lifestyles for an increasingly urban. Today, cities around the world are facing the major health challenges of our time, from tackling the spread of infectious diseases to ensuring healthy lifestyles for an increasingly urban global population. Urban areas can be unhealthy places to live, with people in towns and cities experiencing increased rates of non-communicable disease, injuries, as well as environmental injustices. That's why in 2020, WHO and UN Habitat jointly released Integrating Health in Urban and Territorial Planning, a sourcebook for urban leaders, health, and planning professionals. The sourcebook builds on the principles first introduced in the International Guidelines on Urban and Territorial Planning and the New Urban Agenda, and it considers how these principles and processes are linked to the Sustainable Development Goals. It advocates for urban and territorial planning as an inclusive and participatory process. It shows how an integrated approach to health can influence decisions across sectors, including housing, transportation, employment, and more. It also brings together two vital elements we need to make healthy cities on a habitable planet: processes to guide the development of human settlement, and methodologies to make human health, well-being, and health equity a priority at all levels, from the local to the global. The sourcebook takes users through the different steps of the planning process and illustrates tools and relevant case studies for each component. It identifies entry points, including places, people, and processes which can help lead effective actions and use health as a catalyst for progress across a range of entry points. It includes advocacy frameworks, guidance materials, and links tools available for the appraisal and analysis of health and health equity. Whether you're an urban planner, a city mayor, a health professional, or a local community activist, this publication was created to inform and inspire you, so together we can all contribute to a healthier urban future.
Yes, thank you. Can you go back to, yeah, it's first. And since we have absence of both WHO and UN Habitat, it comes at the right moment. Yes, get next. Okay, yeah. And so what we have been doing with them together and intend to continue is testing the sourcebook through very interactive workshops and every time taking a specific entry point into the topic of health and urban planning. So normally today in the afternoon that would have been starting from different spatial factors like land use, transport and movement, for instance. How does that affect public health in different aspects? How can it protect you from harm? How can it promote health and provide services? And now there is a fourth element coming up soon, next year, I think. And paying attention to both physical health, mental health, and health equity. So that is one example of how an entry point is delivered. Previously we did one and the entry point was public spaces. And then around public spaces, looking at different aspects, stakeholders, at how you can use inputs from the health sector and how can you use the health indicators again to measure your outcomes. And then the video, yes, and we also have a short welcome from the Secretary General of Metropolis, Octavio de la Varga. Yeah.
Hello, I'm Octavio de la Varga, Secretary General of Metropolis, the World Association of Metropolitan Areas and Major Cities from all around the world. Right now we count on 143 members, representing all the regions and all the diversity of metropolitan areas, metropolitan spaces, and major cities. I'm sorry I cannot be with you during your Congress, the Congress of ISOCARP, because at the very moment that you are having your Congress, we are holding our Congress, our 13th Congress. And in fact, I think the themes are quite similar. We're discussing about how to rethink and shape the future together, how we rethink the transformation of our metro spaces. The pandemic has shown us and confronted us to the paradox of our urban development, to the contradictions that we have been carried out, and as well it has shown the inequalities that our citizens are suffering because of the model, of urban model, and the way our metro areas have been developed. In this sense, we consider that the pandemic has forced us to reconsider all these aspects, and in fact, last May we launched what we call it a call to rethink metropolitan spaces. It was a call to work together with all the actors, with all the members of Metropolis and the stakeholders in order to rethink our metro spaces, in order to rethink how we can make them safer, cleaner and healthier metro spaces. And it's important, and in this sense we are working in the focus of the governance. We consider that governance is essential for these metro spaces. With a sound governance we cannot sort out these problems, and this sound governance should support We should be supported by social cohesion, economic development, and environmental sustainability, of course, gender equality. We've been developing quite a lot of tools. One is the Global Health Cities for Global Health, a platform where we've been exchanging experiences on how to respond to the COVID, how local governments are fighting the COVID, and the all spheres, not only from the health sphere, but as well on the economic, social, cultural, educational, and as well with the transformations that are needed to respond to the challenges that we're confronted to. We are also working with our members in exchanges, in training them, building capacity, thinking, at the end of the day, thinking of a new way of urban planning, of a new way of metropolitan planning. In this sense, we also advocate for a narrative, a metropolitan narrative, in order to put at the center the issues of metropolitan spaces, because we all know metropolitanization is unstoppable, but we need to think about how we metropolitan spaces relate to other territories, to intermediary cities, to peripheral cities, to the rural-urban links, and how we together, the policies that we develop at the metropolitan level have an impact at the regional and national level. And so together we need to sort out this discussion. It's not only a discussion of the metro spaces, it's not only a discussion of the leaders of these metro spaces, it's a discussion with all the actors and with all the different perspectives. So I wish you a lot of success in your Congress, and I hope we'll be working together in the near future.
Thank you. So we will start with our panel debate, and I will introduce you shortly, and I suggest the panel members can say a little bit more about their work and background. We have Charles-Edouard Delpierre, General Manager of Urban, Tractebel. He's also in our scientific committee from ISOCARP. Antoine de Borman, CEO of Brussels Perspective. It's the Brussels Planning Agency. Welcome. Federico Ailli, Project Manager with ISOCARP Institute. Huda Shaka, City Advisor, worked in several places in the Middle East and is a member of our Community of Practice on Urban Health. And Dr. Slawomir, or Slavik, as we call you, Ledwon, Urban Planning Expert, ActiCity, and also a member of our Community of Practice on Urban Health. Welcome. Can I ask you to take place here? Yes, maybe the other PowerPoint, yeah, with the 3 slides. So we have one person with some slides. We will start with Charlotte. You will put your 3 slides, I think it's okay, yeah. So the idea is that you have 3 minutes, more or less, to either give a statement, explain a concept, or some key points of your practice, and then we can enter some discussion. Yes, please.
Okay, so thank you, and good morning or good afternoon to all of you. Indeed, I have prepared a few slides, but I will go very rapidly. Can I have the... yes.
Yes, yeah.
To be
You
more convenient.
Yes.
Thank you.
You just have to point there.
Okay, so just what is at stake is, as you were just saying, that health is becoming, or has always been, in fact, a key component of the urban fabric, both on the design or planning phase, and of course on the more operations. In a Tractebel case, which I'm presenting today, we are involved in both not really the planning of health and healthcare facilities in cities, but more in the construction sites, more in the engineering sites. And I would like to share a concrete example in Belgium, in Liège specifically, where we were part of the design and construction team for the new hospital of Liège. It's quite a big hospital campus. And in fact, we had to accelerate the termination of civil works, of the construction of the hospital at the moment of the first lockdown of the COVID-19 in the beginning of 2020. And the anecdote is that we have been contacted by the local authority of Liège and the owner of the project, of the hospital, just before Christmas, because they had heard that we will probably go to a lockdown period, and we had to call our guys, our teams, to work during the Christmas period, and all January till inauguration in February. And this is showing that how we can be innovative, in fact, in order to work, to accelerate to work, and to work collectively between the public administration, the public hospital, the private stakeholders, 2 architects, 2 engineering companies, 2 EPC contractors, plus a few subcontractors, in order to make this story happen. It is to say, to open, of course, not the full hospital, but part of it. One of the key lessons learned was how to also work with firemen. Because when you need to open an hospital, of course, you need to have all the technical facilities operational, but also to have the certification from the firemen in order for fire safety, fire protection of the facilities. And this was, from the lesson learned, the most critical issue, or the most difficult point to obtain. It was not to find guys to work on the project, to finish the works. It was really to obtain this kind of go at the end of the project. Another thing I wanted to share is that we also had to be innovative in order to find and to install temporary tents on the car parks around the hospital, which was, you remember, in the beginning of 2020, everybody wanted to find temporary tents around hospitals, hotels, etc. And just to conclude, in addition to this kind of projects that you see here, so you can see the Red Cross facilities that we coordinated, the temporary tents, the projects. That we also work on, so of course on a few other hospitals, and we received a MIPIM award last month or 2 months ago. I was in Cannes to receive the award for this project as a, I don't know how, no. No, this one. I don't know. So we received a
There was 3 slides. Yeah.
I don't know how to go to the last one. Yes, so yes, we received this award in a MIPIM as the best healthcare development that has been awarded globally, because also of this link between the project and the architecture and the technical side, but also this flexibility to work with public authorities, to open it before, to find solutions, and to receive all the authorizations to open the facility. Thank you.
Yes. May I invite Antoine to say a few words?
Sure. So I'm the General Director for Perspective Brussels, which is the expertise centrum for Brussels and the Brussels area. I actually wanted to react especially to the guidebook that was presented earlier in the presentation. I find it actually really inspiring to have this different sequential presentation of what impacts health. And as you know, urban health will also be the center of the next year's ISOCARP Congress in Brussels. So we believe that it's really interesting to approach the urban planning in the sense of health. Why? Because it's really centered actually on the individuals and on the human beings that actually go towards the city. And so, of course, this three-dimensional sequence on health is put under specific stress through 3 different events that occur at the moment, which is of course climate change, which is of course the aging of the population, which is of course different from one town to another, which is really some concern in the European continent in general, and also a more specific conjunctural theme, which is of course the consequences of the pandemic, which is, of course, as we saw, has consequences in the short term, but are also consequences in the mid-term and long-term that are actually still difficult to anticipate. And so it's a better specific period for us urban planners to be able to anticipate all the different consequences that this will have in the future. I just wanted to introduce 3 tools that we use as urban planners to kind of try to elaborate on those specific stresses. First is what you talked about, protect from harm. And as you know, we introduced a low emission zone in Brussels, which is, this specific tools is designed to progressively reduce and calibrate the vehicles which can be used inside the Brussels area. And this is a tool that we introduced in 2018, I believe, and is actually progressively reducing the kind of vehicles which can actually be used, considering that every year some of the most polluting vehicles cannot be used anymore inside of the Brussels area. So at first nobody notices really the change, and progressively it has a more and more structural effect. Second tool is the fact that we use a grid of analysis regarding health when we start an analysis over a zone on which we will do a specific planning, which is also, it's kind of a health impact analysis, which was done to introduce with a set of factors how the urban planning will be impacting health of the individuals which either live or use this specific zone. And a third tool is, of course, something that you already know as well. It's more of a concept. Is actually this concept of the multifunctional proximity city, which means that for each area we try to be sure that all individuals will have all the necessary services and infrastructures which they use on a daily basis. And this, of course, is a sort of operationalizes what you see, what you presented us on the fact that you want to support behaviors from individuals which are actually in the sense of promoting health. And of course, if every individual has services and infrastructures, considering walking, cycling, but also reducing the impact of vehicles and individual vehicles in town, then it will, of course, promote healthy behaviors. So these are like the three. We of course have more elements that we could present, but 3 specific tools that I wanted to put focus on, which actually kind of translate those concepts into operational tools. Thank you.
Yes, thank you, Antoine de Borman. I'll pass it on to Federico first. Yes.
Thank you. I quickly bring the experience that I'm having together with ISOCARP Institute on an European funded project which is called Var Cities, visionary nature-based actions for health, well-being and resilience in cities. The topic of health, of course, was a priority and a major interest on the agenda of ISOCARP, and we finally managed to start being involved in this project starting in September of 2020. It's an Horizon 2020 project led by Technical University of Crete and focusing on nature-based solutions. In this project, the innovative part related is really the focus on health and bringing together multiple dimensions. In fact, the approach of this project is really implementing nature-based solutions, but in public spaces and using green public spaces to increase the health and well-being of people. So we have eight pilot cities spread in Europe in different climatic conditions. It means that we have cities in Norway, like Bergen or Skellefteå in Sweden, but we also have Leuven in Belgium, where they are working on the regeneration site of the new hospital. You might know it. But we also have cities like Chania in Crete, and we have Zira in Malta. So they are very different contexts with different problems, and we're trying to propose an integrated approach with implementing, co-designing some intervention to improve the accessibility, the quality of these green public spaces. Connecting it also very importantly with smart devices, and so with as a component of smart cities, especially to monitor the results, to monitor the improvements, for example, in terms of air quality, acoustic pollution, and also to increase giving a possibility to citizens who are using and making use of these public spaces to see the results, to see the benefits and the impacts of health and well-being, and also to increase awareness about the topic. The project has started, so at the moment 8 pilot cities are running a series of co-creation workshops to refine the solutions that were initially implemented and identified in the grant agreement, and the project will last until 2025. The role of ISOCARP Institute is more focusing on the outreach to policymakers and to other municipalities and to the broader community of urban planners. So if you are interested or if you would like to connect, or you would like to share some experience or somehow to find some space for collaborations, our 8 pilot cities will have to run and to engage with other municipalities and with other cities in Europe. So we are very happy to explore and to have a new connection with whoever is interested and who is willing to work on the topic of health and well-being for citizens. Thank you. I think that's a very short overview. And if you have other information, of course, you can ask me later.
Okay, thank you. I'll say a quick word now because we move to 2 members that are going to focus on the environment of the region, which is hot and arid environments. And I have a few numbers here that can give you a little bit an idea about the Arab region, that it is most affected by temperature increases, and especially the urban areas. The average temperature, for instance, they would increase 3 degrees throughout the region by 2050, and an additional 3 degrees also in nighttime temperatures due to the urban heat island phenomenon. We have also a highly exposure to extreme weather, natural risks, and another risk is displacements and migrations from the rural to urban areas. So that there are numbers with large possible mass migration. And in the low-lying coastal regions, I mean the Arab region, not just here, but extended until also including Somalia, for instance. The region has also a lot of port cities, over 43. So the rise in sea level will also affect cities in this region. And then the question is, of course, also what is the impact by this climate change on human health, and could temperatures in some regions go beyond the threshold of human adaptability? Question mark. And now we will move to 2 people who, Huda, Shaka, first, who will tell a little bit more about ideas and concepts in this context. Thank you.
Thank you. Thank you very much. My name is Huda Shaka. I'm a chartered environmentalist and a chartered town planner. So most of my work is at the intersection of urban planning, sustainable development, and public health. And I've most of my professional life has been in this region, between working first for a developer and then for the private sector for 12 years as a consultant, and now recently as an advisor for a government agency. And trying to answer the question, and today, I'm sorry, I have more questions than answers, but trying to answer the question, what does sustainability, sustainable development, resilience, safety, security look like for a building, a neighborhood, a big infrastructure project, or a city in this region. So, take a typical example. If we talk about green spaces, and this is my comment for anybody who would listen. SDG 11 is the one that speaks to me the most. But I feel like I want to change one word in one of the KPIs where it talks about access to green spaces. I would like that to be access to nature spaces, because what does green mean in a context of an arid climate where there's very little water, where actually in many cities around the world, the city is brown or yellow or glass, and the suburb is green. In the Gulf, it's flipped, because the suburb or the rural is yellow, it's sand, and then the city is artificially green because there's a lot of water being pumped into grass or trees, etc. And people then talk about, well, you need the green spaces for the shade or for air quality or for etc., etc. Well, actually, the trees you're planting don't give you shade. Who says, I studied atmospheric chemistry initially. Planting trees was never one of the air quality mitigation measures we took seriously. Landscape architects will tell you differently, but what does the science say? What type of trees? Does it have to be trees? So, and then, don't get me wrong, I am a chartered environmentalist. I'm a friend of trees. What I challenge people to think about is how can we integrate nature in our cities in a way that will have positive health benefits, positive environmental benefits, biodiversity benefits, economic, etc., etc. Not just cactus, actually. It's there's a very wide variety, and lots of trees that do grow in the desert. So this is the thing. For example, gaff trees are very green, lush trees that you will see naturally in an arid environment. Palm trees only occur in an oasis in the desert where there's lots of water. But if you're trying to impress somebody and want to draw something, and you just throw lots of palm trees and people feel like this is a sense of cultural identity, and then try to explain to them that actually look at what you're doing. And there have been countries in the region who have tried big forestation initiatives, and they've realized decades later that they're depleting all their groundwater. And now there are policies. In the past few months, Kuwait and Saudi Arabia have decided no more palm trees in the city. And so things are changing, and a lot of it is about raising awareness, asking the right questions, looking for locally relevant research, and practitioners that are willing to listen and take in the context. So I'm very happy to have more of that discussion later on.
Yes, thank you. Huda. And Slavek, yes.
Yes, thank you. So welcome. Welcome also to Doha. I've been living here for 7 years now. So thank you, Elisabeth, for the invitation. I wanted to talk about two things. One is ISOCARP initiative that we had as part of Mentor and Student Research Lab. And the other one is about ActiCities and my passion for running, actually. So I'm a trained architect and working as a planner, but I like to run. And the way I look at the city is pretty self-oriented. Where can I run? Where can I exercise? And that drives me in a more of a private way to look at the cities. How can they become more active? And of course, introducing this notion that running or runnability index, when you have walkability indexes and how they are connected, is something new, because runners need a bit of a different space. But that's oriented towards myself and how I see the cities. So what we did with ISOCARP, there is this initiative, Mentor and Student Research Lab, when a mentor, an international mentor from ISOCARP would come to a university and do some research. Elisabeth was part of the same edition we did, third edition with Gdańsk University of Technology. That was the last one before the pandemic. Actually, yes. we had to cut it halfway before the last conference. But the idea is that we exchange knowledge between the younger generation and we do something something that leaves a mark. So my group was working on a toolbox for promoting activities, physical activities in cities. And it was to be very simple. No big ideas, no big strategy plans, but rather something that can be implemented and just to make those small differences for the small communities. Because health is towards us, individuals, right? It's not a big plan, but it's where you can, as yourself, go, or you can exercise and you can be more active, or even walk outside. So we tried to get a lot of ideas, a simple one page, what it is about, what does it implement, and what are the case studies. So for example, how to use unused spaces for activities that you have under a road, elevated road, you have space that nobody uses. With a simple intervention, you can give a place for community, for those people to go and walk. Maybe if it's long enough, they can run. Maybe they can cycle. Maybe they can play football. So the aim was to give this toolbox also to the local community in Gdańsk. We wanted to have a workshop at the end of the student research lab, where they could start picking those ideas that they could implement in the local community and do for a participatory budget as a project from the city. We're hoping that it's very useful. So just trying to be at the low level and more like a bottom-up approach, what people need for those active spaces. So it is around 80 pages of ideas that can be taken, how to integrate different groups of people, different ages, different abilities, but also we wanted to go beyond. How can you build a physically active community? So for example, I'm living in a place where I don't know with whom I can run, or I would like to play football with someone, but there are no teams. So there are these different ways, apart from the spatial aspects and the design aspects, that we can bring those communities together to be more active. So that was one of the projects. The other one, of course, Elisabeth mentioned the hot climate. I was looking at how people are active in a climate like Doha, where temperature is one thing. Everybody asks about how hot it can get. Okay, it can be 50, right? But the 50 is not only the thing. If at night it goes to 38 and the humidity goes up, it's even worse. But people can actually exercise outside. I'm just wondering, and this is another question, how high it can get that we reach this threshold. So I go outside and exercise in the summer, but it's much slower and much difficult. And for you coming here, we had the ISOCARP run yesterday. Everybody was saying it's hot. Being Polish, and we have snow and all this thing, I was not used to that, but my body got used to that. And now in the summer, I think it's hot, but yesterday it was actually pleasant outside. That's the adaptability, but how far can our bodies adapt to this, right? I mean, there has to be a threshold, and at some point it's just unhealthy. And I've seen people in the summer dehydrated or with almost a heat stroke. That's not healthy, right? And if we imagine in many places of the world this will be happening, that's something worrying, right? And of course we have this experiences here to talk about this, how we manage, how we cope. But the observation was that it's not only looking at the temperature, it's looking at heat index, which actually impacts the human body, so combined with humidity. And I totally agree with Huda regarding what kind of spaces we provide. It's not always exactly what it should be in terms of providing also the space for active people. On a positive note, I'd like to end on a positive note about the pandemic, is that I observe here people learned to be more active outside. I have a wonderful park outside my window, and it was pretty empty before the pandemic. Then the lockdown came, which was springtime, so the weather was pleasant, we say. And I saw people outside because they were allowed to go and walk, but the shopping center was closed, everything was closed. So they started walking. And I found it's like a rediscovery that we can simply walk. And now the shopping centers are open, everything is open, and you see how we operate here. But I see people, maybe less than last year, but I see people out of my window still walking there, starting to jog. So I think this is at least something we can focus on a positive note, that we are rediscovering our physical activities. Thank you very much.
Thank you, Slavek. I will immediately open the floor for questions. Who has a question? Yes. Maybe they asked me to ask the question in this direction. I
This
don't know.
direction, okay. So very interesting discussions. And I was...
stand here or stand up?
Yeah,
Sorry,
sorry.
or on the side,
Like this?
sorry.
Okay. I was very intrigued by the discussion of biodiversity and nature-inclusive solutions in cities, but not the way we are thinking about them. And I was wondering if you have any examples or any of you of solutions in this kind of climate that are not the ones that we're used to, but ones that actually bring nature in the city or make the city more friendly, let's say climate friendly for both animals and humans. So I'm wondering if any of you has any examples of that.
Thank you for the question. It's actually a topic I'm starting to learn more about and get more interested in. Integrating nature in the city and nature-based solutions. The example I'll give you is one from Abu Dhabi. So Abu Dhabi is the capital city of the UAE. It is, as the capital city, it was actually on a low-lying peninsula with lots of mangroves all around it. A lot of those have been dredged and destroyed, unfortunately. But when I was working for a consultant, we had the project that was overlooking one of the mangroves. And kind of the conventional thinking is, build on top of it, destroy the mangroves, and then put lots of green parks on your newly, reclaimed island. And believe it or not, it was kind of innovation. It was this brilliant idea when we tried to explain to them, well, how about we keep the mangroves, face the development towards it, so it actually becomes an asset for the development, give people access to it so that it could count as part of your open space from an urban planning zoning perspective. And it actually worked. Well, I say worked as in we got the master plan approved. Now it's not constructed yet, but that just, it's a paradigm shift. It's more of a mindset, getting people to see the mangrove as opposed to, oh, it's taking up some of my space, to it's an asset and you can. Also, the mindset here is if there's valuable nature, then you put a big fence around it and nobody's allowed to touch it, or you destroy it and do something else with it. So this idea of preserving, protecting the nature, but also allowing interaction with it so that people benefit from it is new, and that's what we're trying to kind of build into our planning practice.
Yeah, I may add to that, because actually that's a very good question. Maybe not talking about the natural nature, but the landscape nature, which I think is, you agree, is prevailing in a way what you see here in terms of biodiversity. I think this is more from the planning perspective. Bringing activities or reasons for people to be there is the key, because many of what you observe, especially I think in the region, many of the areas are green, have grass, have palm trees along the streets, or at intersection, because there are the publicly planned space that gets developed together with the road. But there's no purpose for me to go there. It looks nice, but how can I interact? And some of the parks are also very nice, but why would I go there? Why would I go there with my children if there's only a lawn and those trees? Of course there's shade, but you can go somewhere else. And what seems to work is that if you bring the kids, the parents follow, and when they follow, they also can have another activity, and then it becomes a lively meeting space for people to be closer to green space and blue space as well, because that's usually how they are developed all together. And then it starts to function as a kind of a meeting space and as an active space. But it's not only what kind of activity there is for children, but what can do the adults at the same time, or what kind of sports you can play. What I see as a prevailing approach is that football pitches are provided, so you can find them in different areas as okay, a space for the public to play, but no other sports are happening. And for example, here cricket seems to be a socially popular activity, but there is not many places where those players can meet, and they use just totally abandoned plots, large plots, to play cricket. So I think if we try to get different activities in one space, it brings more. It brings more, and is the driving factor for that.
Thank you. You may also have a question for each other, maybe. That's allowed. Somebody here.
So there's been more and more research coming out in the last few years about, and the shift towards being preventative rather than treating things before it becomes a problem. Should I take my mask off? Okay, so there's a shift in policy about being preventative, especially in the UK. And there's more and more research coming out about the effects of the even small amounts of activity that people do day to day, instead of making an effort to go and do exercise and do things at a particular time. And I think that's really important because not everybody has got the time to go and do something at the end of a working day. Not everybody gets paid enough to go and be a member of a gym and all of that stuff. And we know that there are relationships between urban form, density, street networks, land uses, walkability, and how active people are. And I think my kind of question is that it's easy to put those conditions in place. We can see what those conditions need to be, and we can put them in place when there is new cities growing. But what's really scary is when you look at the UK, UK is a really kind of bad example in a lot of ways. If you look at almost all the urban growth that has happened since the 70s onwards, the new towns, a lot of the kind of edge of city growth, it's all low density, single use, cul-de-sac type development. It's almost impossible to walk as part of your everyday life. Even if you want to, the distances are longer, you have to cross big roads, all of these sorts of things. How can we retrofit existing cities to try to make places not to enable people to be active because they want to make an effort to play football or something in the evening, but so they can walk to work or cycle to work or all of these kind of things. And I think that's a really big challenge in the UK, but probably in other places as well.
Yes. So,
I'll start with a brief answer, and then I'm sure other people can add. So that's a fantastic question. A small anecdote. I did a one-year master's degree in London, and there was an international group of 20 people. And when we asked the question, is London walkable or not, this was 2015, 2016, half of the class said it's fantastic, half of the class said it's rubbish, compared, depending where they came from, right? So the question you asked is a question Dubai is asking, and they have some solutions. So there are new developments in Dubai which have been built very kind of vehicle-centric. It's how do you retrofit them back in? Sometimes the answer has been provide different modes. So there's the I can't remember what you call them now. The buggies where you just you get on. It's like the skaters. What's the name of the
skateboarding?
So the thing is, they are micro mobility solutions that are not active mobility solutions. So that doesn't help you with your activity. It doesn't help with the health. It helps with the carbon, but not with the health. So it's what are the planning solutions that are active and zero carbon? It's really only kind of walking and cycling. And what can you do to integrate those in? Sometimes it has to be a mix. So you won't be able to walk to your grocery, but if you can walk halfway and then take a bus, if you can get people out of the car, right, and then do multimodal. So as long, because the metro is never going to get you to your house. You're not going to park your metro and get off. So if you can push towards public transport, you almost then, by default, create the demand for active travel for the first and last mile. And then you have to kind of get it to be a bit easier, put the paving and the cycling in. But there are cities around the world that are retrofitting. Paris is a great example on cycling. So I think it's a question we will have to all work on. It might, in some areas, mean higher densities and change of mixed use. So you have to change the zoning to allow the mix of use, change the zoning to allow the higher density. But I don't think there's a quick fix, unfortunately. I think it's kind of lots of small initiatives over time.
I just wanted to react to this and also to what my colleague said a bit before, because you said also that the pandemic has a positive effect on active, active mobility especially, and made me thought that pandemic has actually positive impacts not only on active mobility but also on air pollution, for example. So on the short term, the impact on health was actually positive on some aspects. But the question that you also ask is what is going to be the evolution on the long term? And you see that, well, of course, the adoption of healthy behaviors in time of crisis can also last in the long run if the infrastructure is also adapted. And for example, in Brussels, we took also this opportunity of the pandemic to accelerate a lot of infrastructures, which was the case in Paris as well, I think in a lot of different cities. But we are now also in some transition time. And the question is, of course, how are things going to evolve in the longer run? Especially in in places that I know better, in Brussels, where there is also this kind of tension between, on the one hand, the objective to have more dense cities and to increase density on urban areas, especially in areas where mobility hubs are well developed. And on the other hand, this, the impact of teleworking, which means that a lot of workers actually rather would go live a bit further from the urban center and be in a more greener or more natural environment where if they only have to commute like once or twice a week. And this tension is still to be resolved because, of course, the question there is which attractiveness you have on urban centers, to be sure that also all the working people are staying close also to your working areas, which means also multifunctional cities, of course. And I think this is one of the challenge that is really that we have to tackle in the future years, to really resolve this tension and to be sure that those denser but also more multifunctional and attractive urban centers are even more attractive after the pandemic than it was before, to really, I mean, it's a even more important challenge in the years to come than it was before, because we have this impact of teleworking on urban centers. And of course you can develop a lot of infrastructures for active mobility, for example, but it's not going to work if you are living like 40, 50 kilometers away from the urban center and after your working area. So yeah, I think that's some even important, more important challenge in the years to come.
Maybe I can also react to the two questions. Very interesting, thank you. With a few examples. Maybe a first example that personally I have worked on was in Australia, a new capital city around Brisbane, a city called Springfield, where we have been working on stakeholder engagement with the public authorities, transport operator, the populations, the school education system, health system, etc., to design a more eco-friendly city or let's say suburbs. And part of the most difficult part was on what you call the nature-based solutions, which, because the reflex is, okay, let's put solar panels on any kind of building, let's use the car parks to put again solar panels, and then you continue to think the city, the future of cities, through the individual cars, and through the fact that we don't speak about nature, we speak about just to put some green things, not nature, which can be green or another color, in fact. And you spoke about blue versus green. So there was this tension between, okay, the future of eco-cities should be green, but it's a bit of, okay, we just put some trees and we don't know which ones. The future of cities should be still through individual cars, and we try to greenify cars, and we try to put solar panels, but where do the solar panels come from? How to work with the stakeholders of energy, because the electricity that you produce from a solar panel that you will put to a charging station from in an electric car, you need to have the grid operator in between. And what do they want to do? And can they be involved? What is the nature of their contract with the municipality? Are there any contract with the transport operator? No. Do they speak together? No. And how to deal with that? So this was one example. Another example on what my colleague from Belgium said is about the car, let's say, car policies. In my company, we try to, all the managers in Belgium have a company car, which is part of the, let's say, the package, salary package, and that's it. And we try when you discuss with national authorities in Belgium to say, okay, look, it does not make any sense to have a car. And why do we have a car? It's because there are less taxes on the car than on the salaries. So it's like not a positive or virtuous cycle for the planet, let's say. So we try to have this dialogue. And part of the answer is to have not for the same, let's say, amount of money, not speaking about tax regulation, is to have not a car, but a mobility package. So you have a part of a budget that you can use to rent a trottinette, you buy a bicycle, you buy the best tennis shoes because you are a runner. So and it's working very well. Some of our colleagues, they decide to stop having a car, of course, to keep the budget and to buy a bicycle, to go to bicycle, to rent and they only rent a car for in the weekend because they need to go somewhere else. And this, I think, is maybe something interesting to be shared.
Yeah, I really appreciate the discussion. It's going very interesting. I mean, just to touch on your last mention of the active mobility to work, there are people who run to work and back from work. I know them, run commute. It's also doable. I've tried it back home. Another mention that came here is where we're coming from and what kind of environment we have. But I had a presentation about the active cities, and I was in India. And when I looked at what's in India and compared it to what I would be thinking about of the strategies and so on, it's a completely different world that I saw there. And I felt like, we have to try to address what's possible in this area, because there, walking is almost impossible. I wouldn't say difficult, right? So we have to address those issues rather than think about these higher strategies that we would like to implement. So that's a very good point. But coming back to the UK question and what can we do, this brought to my mind again a bit self-oriented thing. I was working at the university, the technical university in Gdańsk in Poland, and I would cycle to the university. But I found some things not helpful to be at the university with my bicycle, just like other students and workers. Basically, it was the safety of keeping the bike and where I keep it. And it was so simple. I know it may sound banal, but I thought, let's have a class. It was architecture faculty. Let's try to fix our university just to be bicycle friendly, to be able to get there. So we created a whole set of recommendations for the university, what we can do just to make it a bit pleasant that people can come, with studies, how often people come, what the students would like to have, and so on. And the basic fix was, I want safety for my bike. I know it seems really banal, but this is what we had to address. So we proposed where the bike stands could be, what kind of bike stands. Maybe there is a bigger building that I can change. I have to have a class, I cannot be all sweaty, right? Those very simple things. We cut the bars that cars enter to the university. We cut them, I think, 0.5 meter to have this, 1.2 meters gap that the bike can go in, because there was no place for the bicycles to go in. Most of the pedestrian entrances were stairs, so some of them we could fix with a simple lamp. They were very simple solutions, and that worked. I mean, people were appreciative. Now we can cycle more easily. On top of that, we added this social or strategic or inter-student activities, that there was an event, for example, talk about your bike trips, or a movement, bike to the university, become a part of the movement. So these very simple things worked, but only for this case, right? So I think this local bottom-up, again, brings it to the table. What can you fix? Because I'm not sure what are in your mind the cases, but definitely there's something you can address, even in the small thing, that the community can build on. So thank you for that question and also for the discussion. Yeah,
thank you. We're almost there, but I have a question too. And it touches upon what many of you said, whether it be about Charles-Edouard, that we have to work more collectively, and COVID forced you to do this. The innovation we've seen in urban spaces, some of them has been transformed into more sustainable measures, but a lot of them, in fact, during lockdown, you had all these innovative pop-up and tactical urbanism projects, but a lot of them also disappeared, and in fact, there's an increase of car use, etc. So what is it in fact? And a lot of the elements point to, especially since we think about health and climate and the different crises together, is that we have to collaborate together. Worldwide it's a problem. The governments are structured very sectoral, that is sectoral pillars. The health sector, climate, mobility, planning. So how can we, or who should we put around the table to move forward and maybe leap forward with big steps? And yeah, maybe some idea on how we can also accelerate that point or make big progress. Yeah, maybe a little.
There was a really good example from London a few years ago. What was happening was the Transport for London was investing in active travel kind of measures, walking, cycling, public transport. And the benefits were being reaped by the health authorities in terms of, so the transport authorities were paying, the cost saving went to the health authorities because they were, better health of citizens, so they were spending less. And so there was no real incentive for the transport to do that. So what happened is they created a joint effort, so between the health, the environment, transport, so that they could jointly share the cost and the benefit of that. And I think it comes down to understanding who are the losers. There's always going to be losers. Who are the losers? Who are the winners? How can we make it a better deal for everybody? I think in terms of Gulf cities, I fully agree with the impact of the pandemic. People have actually tried to go out and walk or take a different route to work, and a lot of that, or some of that, is going to stick. I'm very sure about that.
I maybe add one thing related to nature-based solution. I think when it comes to collaboration or to bring together different departments, I think it's one of the most potential aspects of nature-based solutions are the so-called co-benefits. So being able to identify what could be the co-benefits, it could be a useful step to bring together and to cluster the relevant department and also identify the stakeholder and the local communities which might be more affected or interested in a specific project. And I think in this sense, public spaces are great because they can really touch and they can really work at different level and different departments.
I think what you ask as a question is actually a very tricky question for us urban planners, because we are actually not really used to have an answer in the short term, and we really work more in the long term. So it's kind of a paradox that we have to find quick answers with tools that actually are not well designed to answer on events that occur rapidly. And so my answer would be that first, of course, urban planning is not always a good answer to quick changes. But on the other hand, if you do changes rapidly, but that there is some distortion, that sometimes you do, for example, tactic urbanism, but that you have to go behind or go in reverse, because actually tactic urbanism, what does it mean? It means that all the rules were not followed, that permits were not asked, that you did kind of a distortion on the rules. And so it's of course very interesting as an instrument, but if it means that you have to go in reverse and backwards, then it means that you're going to lose a lot of time. And so my answer would be that sometimes taking the time to put all things together and to be sure that all actors converge to the same solutions is actually sometimes a better situation and conditions to be sure that those changes are going to really be implemented in the longer term. On the other hand, I think especially in all cities we have complex governance structures, and especially in Brussels, but of course in a lot of different places where the governance is not so easy between local entities, regional or more national institutional levels. And there I think that being sure to converge on some objectives is actually the strongest way to be sure that there is a cohesion of all the different actions, that all converge to the same objectives regarding, for example, health or environment or other important objectives, and to be sure that once it is well appropriated by all the actors, then all the different actions can actually go in that same direction. Otherwise, you still have those conflicts which are never-ending debates over what should be done or and which objectives do we pursue collectively. So, which doesn't mean that you cannot use, of course, shorter term answers, but that's some maybe a question for another conference, which is not of urban planners. Then.
Okay, thank you. I will just give some key takeaways of what we heard today. So we heard that the pandemic can help also in like a crisis situation. As we heard from Charles-Edouard, you have to work together, and the whole topic of collaboration is very important with all the crises ahead, and I think we have to renew and find new ways of doing this. An entry point would be, as Federico mentioned, also to from the start think about the co-benefits of think strategic, and about the co-benefits might be an entry point to work with different partners together. We will also need innovation, and yes, that's a topic for maybe next year's conference. How can we turn innovation into, how can we enable it in the first place, because with climate the time is also short, so we have to, I think, amplify the opportunities to innovate. How can we do this, and how can we turn this in more sustainable answers? As we heard from Antoine de Borman, sometimes going faster and further means taking time to do so. We also learned about some new tools, I think. The tools that also were mentioned from Brussels, the analysis on impact. I mean, it's nice to hear this. I would like to learn more about it, because it's something that doesn't happen yet. And I think in the Netherlands is the first law on having an impact, an health impact assessment for spatial planning from this year, for instance, but it is very new element also. The proximity concept and the link to everyday life is something that comes back everywhere, whether it be running or more short-term immediate benefits for the community, the whole aspect of everyday life, and then the big issues like climate, pandemics, etc. So how can we put those things together and create benefits? Yes, I think I at most elements. And then, of course, a suggestion that we will send to the UN that SDG 11 should not be about green spaces, but nature-based solutions. Thank you very much.